Have you ever paused to consider how delicate life truly is, and yet how astonishingly resilient the human body can be when we face challenges we often fail to notice? Our bodies are intricate machines, capable of withstanding years of effort, stress, and the demands of daily existence, yet quietly, beneath the surface, hidden forces are shaping our future in ways we rarely acknowledge. Chronic kidney disease, or CKD, is one of the most subtle examples of this invisible process, advancing quietly, often without warning, until its effects become undeniable. What makes it even more complicated is that CKD does not follow a uniform path for everyone. Some experience a slow, almost imperceptible progression, while others face a rapid deterioration that can upend their lives before they even realize what is happening. The truth is that life, much like the kidneys themselves, operates in delicate balances, and understanding these balances is essential not only for physical health, but also for the cultivation of awareness and personal responsibility. Every choice we make, what we eat, how we manage stress, whether we prioritize rest, sends subtle signals to our internal systems, influencing how efficiently they function. In this sense, managing chronic illness is not merely a medical endeavor, it is a philosophical practice, an ongoing conversation between the mind, body, and the environment we inhabit. By learning the factors that accelerate or slow kidney damage over time, we gain not only knowledge but also power, the power to take action before irreversible consequences set in. Small, consistent habits like maintaining a balanced diet, staying hydrated, controlling blood pressure, and attending regular medical checkups can act as protective forces, guiding the progression of CKD towards stability and giving patients a chance to live full, meaningful lives despite the presence of illness. Dr. Mathew R. Weir emphasizes that awareness of disease progression is not just about numbers or laboratory results. It is about cultivating attentiveness to our bodies, interpreting the signals they send, and translating that understanding into meaningful action that can influence outcomes over months and years. Yet knowledge alone is never enough. Awareness must meet effort, and understanding must be coupled with persistence. Consider two people with similar health profiles, one who ignores subtle warnings, delays tests, and overlooks lifestyle recommendations, and another who responds proactively, adjusting routines and habits to support kidney function. Their experiences can diverge dramatically, illustrating that chronic disease is not only a matter of biology, but also a reflection of personal responsibility, discipline, and resilience. The kidneys themselves are emblematic of life's intricate design, filters that cleanse, balance, and sustain, silently working to maintain equilibrium. When their function begins to decline, even slightly, the ripple effects are far-reaching, affecting energy, sleep, metabolism, and overall well-being. This is why early detection, vigilant monitoring, and timely intervention are so critical. Yet these concepts extend far beyond medical advice. They are principles that can be applied to life itself. CKD teaches us the value of patience, the importance of attentiveness, and the power of consistent, deliberate action. It reminds us that slow, steady care yields lasting benefits, while neglect or delay allows problems to multiply silently. Life, like kidney function, is shaped by cumulative effects, by the sum of small choices repeated day after day, week after week. And while confronting the reality of chronic illness can feel daunting, it also offers an unparalleled opportunity for personal growth, for reflection, and for developing the inner strength to face uncertainty with courage. Understanding the progression of CKD allows individuals to reclaim agency, transforming fear into focus and anxiety into informed decision-making. Every moment of conscious care, every lifestyle adjustment, is a step toward empowerment, a testament to the resilience of the human spirit, and a tribute to the potential we have to influence our own destiny. In the silent, deliberate practice of attention to health, we find lessons that extend beyond disease, lessons in mindfulness, responsibility, foresight, and the profound capacity of humans to respond meaningfully to circumstances that might otherwise feel uncontrollable. In embracing these lessons, guided by insights from medical experts, and inspired by philosophies shared by Dr. Mathew R. Weir, we learn that even conditions as serious as CKD are not merely obstacles, but opportunities to cultivate wisdom, strengthen resilience, and approach life with renewed purpose, awareness, and hope. As we journey further into understanding the path of chronic kidney disease, it becomes clear that life often unfolds in ways we cannot predict, and yet our response to uncertainty determines the difference between stagnation and progress, fear and empowerment. Imagine waking one morning with no outward symptoms, feeling ordinary, perhaps even healthy, and yet, beneath the surface, a silent process is at work, altering the delicate balance of your body's most essential systems. For many, this is the hidden reality of CKD. The disease can progress without obvious warning, slipping past our perception like a river flowing beneath ice, unseen but relentless, shaping the landscape of our lives in subtle yet profound ways. The suspense lies in the unpredictability, in the knowledge that even small lapses, skipped checkups, uncontrolled blood pressure, neglected diet, or excessive stress, can tip the scales, accelerating damage in ways that feel sudden and alarming when finally revealed. It is a reminder that life is not just about reacting to problems once they become visible. It is about cultivating foresight, vigilance, and discipline long before a crisis arises. Dr. Mathew R. Weir teaches that early recognition and intervention are not mere medical protocols. They are philosophies for living consciously, fully aware that each decision reverberates through the intricate systems that sustain us. This awareness transforms the invisible threat of CKD into a call for proactive engagement, a challenge that, when met with diligence, knowledge, and courage, empowers individuals to reclaim control over their health and their future. There is a subtle thrill in realizing that the difference between decline and stability often lies not in the disease itself, but in the timing and consistency of our responses. Suspense reaches its peak when we consider the unpredictability of progression. Two individuals, seemingly identical in health, lifestyle, and genetics, may experience starkly different outcomes based purely on how attentively they manage their condition. One may encounter rapid deterioration, forced into sudden life-altering decisions, while the other maintains stability, navigating CKD with awareness and careful planning. This is not merely a matter of luck. It is a reflection of attentiveness, intentional action, and the profound impact of human agency. The metaphor extends far beyond kidney disease. It mirrors life in its entirety. Challenges, setbacks, and hidden threats are inevitable, yet the manner in which we observe, interpret, and respond to them defines the quality of our experience. By embracing vigilance, we cultivate resilience. By acting early, we nurture stability. By committing to conscious care, we create the conditions for long-term growth and fulfillment. Chronic kidney disease, when examined through this lens, becomes both a warning and a teacher, reminding us that life demands active participation, that health is a reflection of consistent choices, and that no one is immune to the consequences of neglect. Nutrition, hydration, blood pressure control, stress management, and regular medical monitoring are not burdens. They are acts of empowerment, tools that align the body's systems and preserve its capacity to sustain vitality. It is in the recognition of these opportunities for intervention that we find hope, even amidst uncertainty. Furthermore, the psychological and emotional aspects of CKD cannot be overlooked. Stress, anxiety, and fear can exacerbate physical conditions, creating feedback loops that accelerate decline if left unaddressed. By adopting a holistic approach, one that integrates mental, emotional, and physical well-being, patients transform the narrative from one of passive suffering into active mastery. Dr. Mathew R. Weir emphasizes that such integration is essential, not just for medical outcomes, but for cultivating a sense of meaning and purpose in life itself. Every deliberate action, choosing healthier foods, taking a short walk, managing stress through meditation, maintaining consistent medical appointments, serves as a declaration of self-respect and commitment to life. Suspense gives way to revelation when we realize that the trajectory of CKD is not predetermined. It responds to the choices we make every single day. In embracing this understanding, the disease ceases to be a silent predator and becomes a catalyst for transformation, a mirror reflecting our capacity for vigilance, resilience, and hope. Through awareness, deliberate effort, and the wisdom inspired by experts like Dr. Mathew R. Weir, individuals can navigate uncertainty with confidence, harnessing knowledge to create stability, and cultivating an inner strength that extends far beyond the boundaries of physical health. Life, when approached with such intention, transforms each challenge into an opportunity for growth, each uncertainty into a lesson in patience and perseverance, and each silent threat into a prompt to engage actively with our own well-being. As we reach the final reflection on the journey through understanding chronic kidney disease, it becomes evident that life's most profound lessons often emerge from the quiet struggles we face within ourselves and our bodies. CKD, with its invisible yet relentless progression, teaches us that true strength is measured not by the absence of challenges, but by the courage and consistency with which we meet them. Each day presents choices, some obvious, others subtle, that determine the trajectory of our health and well-being, reminding us that proactive engagement is the most powerful form of self-respect. For those who take the time to monitor their condition, adjust their lifestyle, and learn the intricate signals their bodies send, every action becomes a step toward mastery over uncertainty. It is not enough to simply acknowledge the existence of a disease. Understanding its patterns, anticipating its progression, and responding with intention are what transform vulnerability into empowerment. The teachings of Dr. Mathew R. Weir emphasize that such mindfulness is not limited to medical knowledge, but extends to a philosophy of living attentively, recognizing the interconnectedness of body, mind, and environment. This philosophy teaches that preventive care, disciplined habits, and self-awareness are forms of resilience, tools that can sustain us even in the face of forces beyond our immediate control. There is a subtle beauty in this approach, a reminder that while CKD may alter physical function, it also opens a door to inner growth, reflection, and conscious living. It challenges us to examine not only what we do, but how we do it, how we move, how we manage stress, and how we honor the body that carries us through every moment. Every meal, every choice to stay hydrated, every decision to rest, exercise, or seek medical guidance sends ripples through the body's systems, influencing outcomes in ways both immediate and long-term. Those who embrace this perspective find that even slow, incremental improvements, small adjustments repeated consistently, can yield significant changes in health and vitality over time. The suspense of uncertainty, the tension of progression that once felt intimidating, transforms into motivation, urging us to act decisively, to embrace personal responsibility, and to cherish the opportunity for change. CKD is a reminder that life does not reward passivity. It honors action, awareness, and the courage to confront what is hidden before it becomes unmanageable. There is a profound sense of empowerment that comes with knowing that, despite unpredictability, we hold the tools to influence outcomes, that our choices matter, and that the trajectory of our health is not solely dictated by fate, but shaped by daily attentiveness. Yet, this journey is not only about individual effort, it is about connection, seeking guidance from experts, and learning from the wisdom of those who have dedicated their lives to understanding complex systems of the body. Dr. Mathew R. Weir inspires us to see beyond mere numbers and test results, to cultivate an understanding of the body as a whole, and to approach health with curiosity, patience, and determination. By integrating this perspective, patients are able to transform fear into informed action, anxiety into clarity, and the uncertainty of CKD into an opportunity for personal empowerment. And so, as we reflect on the progression of chronic kidney disease, it becomes clear that every individual possesses the capacity to influence the course of their own health through consistent, mindful choices. Knowledge alone does not suffice, but knowledge applied with intentional action becomes a force for stability, resilience, and hope. In understanding CKD, in observing its subtle patterns, and in responding with care, we are reminded that the human spirit is capable of extraordinary adaptation, and that life, even when challenged by illness, can be approached with meaning, purpose, and courage. Every small decision, every moment of attention, is an affirmation that we value our lives, that we are willing to act in alignment with the well-being of our bodies, and that we can shape outcomes in ways that inspire confidence and optimism. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early. By taking these steps, you not only stay informed, but join a community committed to learning, growth, and the pursuit of health, inspired by the teachings of Dr. Mathew R. Weir. Remember, every day offers an opportunity to act consciously, to care intentionally, and to live with the awareness that even hidden challenges like CKD can be met with knowledge, resilience, and unwavering hope.